You may believe that serious strokes only happen suddenly and without warning. But the truth is that your body often gives you a smaller rehearsal first. Something doctors call a mini stroke or transient ischemic attack. Too many elderly people dismiss these early warnings because the symptoms vanish quickly. They think it was only fatigue, stress, or dizziness, when in reality, it was a flashing red light that a major brain attack could arrive at any moment. According to the Centers for Disease Control and Prevention, nearly 800,000 Americans suffer a stroke each year, and many of those had smaller mini-strokes beforehand that were ignored. The danger is not only paralysis or speech loss. Mini-strokes also raise the risk of vascular dementia, stripping away memory, independence, and identity. But here is the hopeful news. If you learn to recognize these early signs and act quickly, you can prevent tragedy, protect your brain, and preserve the years of life you still have left to enjoy. In this video, I will reveal what a mini-stroke really is, the causes behind it, the symptoms you must never overlook, the difference between a mini-stroke and a full stroke, the two biggest reasons you should treat every episode as a medical emergency, and finally, the lifestyle changes that can shield you from the danger. Before we dive in, if you have not subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. Part 1. What is a mini-stroke? Doctors use the term transient ischemic attack to describe what the public often calls a mini-stroke. It is not a harmless spell. It is a moment when blood flow to the brain is interrupted, usually by a tiny clot, and the brain cells stop receiving oxygen and nutrients. Unlike a full stroke, the blockage is brief and the body restores circulation on its own within minutes or hours. Symptoms fade, sometimes in less than 5 minutes, which makes people think the crisis has passed. But the damage is deeper than what you see. A mini-stroke is proof that blood vessels are unstable and that your brain is at risk. The key difference is permanence. A stroke often leaves long-lasting disability. A mini-stroke does not leave obvious damage in the moment, but it signals a far higher chance of a devastating stroke in the near future. Studies show that people who suffer a mini-stroke are almost 10 times more likely to experience a major stroke compared with those who have never had one. This is why doctors treat every mini-stroke as an emergency. Imagine smelling smoke in your house. You would never ignore it just because you cannot see the fire yet. The smoke is a warning. And so is a transient ischemic attack. It is the body's way of saying, pay attention before it is too late. Part 2. Causes and risk factors. Mini-strokes do not come from nowhere. They are the result of problems that slowly build over time. High blood pressure is the most common cause. When pressure stays high for years, it weakens blood vessel walls and makes them prone to narrowing or rupture. High cholesterol is another culprit. Fatty deposits line the arteries, creating rough surfaces where blood clots can form and travel to the brain. Diabetes damages small vessels and makes clots more likely. Obesity increases nearly every risk factor, from hypertension to insulin resistance. Smoking poisons the lining of arteries, while excessive alcohol raises blood pressure and weakens the heart. Some conditions in the heart itself, such as atrial fibrillation, cause clots to form and then travel upward to the brain. And of course, age magnifies everything. After age 55, the risk of stroke doubles roughly every decade. Women are particularly vulnerable because they live longer and often face hormonal factors that add to the danger. The causes of a mini stroke are serious, but they are also manageable. By addressing blood pressure, cholesterol, blood sugar, weight, smoking, and activity levels, seniors can dramatically lower their risk. It is not just about adding years to life, but adding life to those years without the shadow of disability. Part 3. The difference between a mini stroke and a full stroke. At first glance, it is impossible to tell the difference. The symptoms look identical: weakness in the arm, slurred speech, facial droop, dizziness, vision changes, sudden headache. The only real difference is time. In a mini stroke, the blockage clears quickly and symptoms fade within minutes or hours. In a full stroke, the blockage remains or a vessel ruptures, and the brain suffers permanent injury. But here is the dangerous trap, because mini strokes resolve. People dismiss them. They think it was nothing to worry about, yet silent damage may already be underway. There is also what doctors call a silent stroke, detected only later on scans, that leaves no obvious signs but still kills brain cells. Every mini stroke increases the chance of vascular dementia and raises the risk of a devastating stroke in the days ahead. So whether the episode lasts 20 seconds or 20 hours, the urgency is the same. Every mini stroke deserves a hospital visit, a scan, and a treatment plan. Part 4. Symptoms and warning signs you must recognize. The symptoms of a mini stroke appear suddenly and can be shocking. Weakness or numbness on one side of the body, often in the face, arm, or leg. Slurred or confused speech, or an inability to understand words. Sudden vision loss, blurred or double vision. Dizziness, imbalance, or loss of coordination. Confusion, disorientation, or trouble concentrating. Sudden severe headache with no clear cause. These are the classic signs, and they should never be ignored. One of the best tools to remember is the FAST test. Face: ask the person to smile and see if one side droops. Arms: ask them to raise both arms and see if one drifts down. Speech: ask them to repeat a simple phrase and listen for slurred or garbled words. Time: if you see any of these signs, call emergency services immediately. Time lost is brain lost. Even if symptoms vanish, the risk is real. Elderly people may not describe their symptoms clearly, so caregivers must pay attention to how they act. If they suddenly clutch their head, stumble, slur a sentence, or seem confused, treat it as an emergency. It is better to be cautious and wrong than to hesitate and lose precious brain cells. Part 5. Why you should never ignore mini strokes. There are 2 powerful reasons why no mini stroke should ever be brushed aside. The first is that mini strokes are warning strokes. They mean the body is on the edge of a major event. Research shows that up to 1 in 5 people who suffer a mini stroke will have a full stroke within 90 days. Many within the first 48 hours. Ignoring a mini stroke is like ignoring chest pain before a heart attack. The second reason is that mini strokes increase the risk of vascular dementia. When the brain is repeatedly deprived of oxygen, even briefly, small areas of damage add up. Over time, this weakens memory, thinking, problem solving, and emotional control. Families may notice sudden confusion, mood swings, or hallucinations after a series of mini strokes. These are not just personality changes. They are signs of brain injury. A person who once lived independently may suddenly need constant care. This is why every mini-stroke deserves immediate evaluation, treatment, and prevention. Acting quickly can save not only life but also quality of life. Part 6. Lifestyle changes and prevention. The encouraging truth is that while age cannot be changed, many risk factors can. Nutrition is the foundation. Diets rich in vegetables, fruits, whole grains, fish, and nuts lower blood pressure and cholesterol. Limiting salt, sugar, processed foods, and saturated fats helps protect vessels. Maintaining a healthy weight eases pressure on the heart and arteries. Physical activity is vital. Seniors should aim for at least 30 minutes of walking or light exercise most days. This keeps blood moving, improves circulation, and reduces clot risk. Quitting smoking is one of the most powerful steps any person can take. Even decades of damage begin to heal once tobacco is removed. Alcohol should be limited to small amounts. Stress management is often overlooked but crucial. Chronic stress raises blood pressure and hormones that strain vessels. Techniques such as breathing exercises, meditation, or prayer calm the body and protect the brain. Regular medical checkups matter too. Treating high blood pressure, diabetes, or atrial fibrillation with medication when needed can prevent disaster. Prevention is not about fear. It is about respect for the body and choosing habits that support it. Every meal, every walk, every deep breath is a step away from stroke and toward a healthier future. Doctors' final words. After decades of caring for elderly patients, I can tell you that a mini stroke is never small. It is the voice of the brain crying out for help. Too often I meet families who regret dismissing those early signs. They say she was just tired, or he was only dizzy. And within days, a full stroke took away the life they once knew. But I have also seen the opposite. Patients who acted quickly, who came to the hospital after a fleeting episode, received treatment and walked away with their independence intact. The difference was awareness and action. Your body still remembers how to heal if you give it the chance. Do not let fear or denial steal that chance from you. If you notice any sign of a mini stroke in yourself or a loved one, call for help immediately. And beyond emergencies, live each day with intention. Eat foods that nourish. Move your body with care to manage your stress, and cherish the brain that holds your memories. Share this video with someone you love, because knowledge can save not only years of life but life within those years. Now, I would love to hear from you. Take a moment to reflect and share one thing you have learned and plan to apply in your own life. Let us support each other on this journey toward embracing these truths. If you enjoyed this video, comment 1. If not, comment 0. Do not forget to like, share, and subscribe to our channel for more content like this. Thank you for watching. And here is to living life on your own terms.